most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about what is causing your shoulder pain. Is it a rotator cuff tear? And how to tell. I'm sure a lot of people are concerned about that because they're pretty common.
Right.
A lot of people call it rotator cuff tear, but it is a cuff tear. There are four muscles that make up the rotator cuff.
Sure.
There are four muscles, and I actually, if you look at this skeleton right here, here's the shoulder blade, and the four muscles actually attached to the shoulder blade.
Right.
So you have supraspinatus, infraspinatus, teres minor, and then there's one underneath, the subscapularis. They all attach by tendon to the bone,
Yep.
and they help hold this bone into the socket and stabilize it.
Right. They keep it in the right position so you do not get impingement, which we're going to talk about shortly.
And they also help move it too, of course.
Yep.
But so most tears, when you hear about a tear, it's not in the muscle itself. It's at the tendon.
Right.
A lot of times right where it could be impinged. You want to show that, Brad?
Yep. And this tendon, the supraspinatus tendon, this one we have in pink or purple, whatever it is the majority of the time the culprit.
The most common one by far. So it happens by the tendon kind of gradually wearing down. You can do it through a trauma too. You can do it through an athletic
fall down.
Yep.
Car accident, whatever.
Sure. So let's talk about some of the common symptoms. So quite often you're going to have pain right over on the side. Tell them, Brad, where is it?
Right. So right there. And you mentioned where that patch would be.
Yeah. If you're a Boy Scout or a cop,
right, you put that
patch
there on the service. The sergeant, my dad had that. He was a sergeant. That bottom point on the rocker, or is the rocker on top? Anyways, right there. I've had that many times from my patients. It hurts there.
It hurts right there.
It's typically in a referred pain from up 2 inches above from there.
Yeah, the damage isn't here. The damage is up here, but they feel it down here.
And that's common in the human body. Yeah. Things refer to other areas.
They're tricky. The body's tricky.
Yep.
So you're also going to have pain and weakness. Very, very common with that. You're definitely going to have some weakness, and we'll show you with one of the tests. A lot of times you're going to have pain, especially when it's just starting to happen, while even resting at night.
Right.
I mean, even just...
Particularly if you happen to roll over on it.
Yeah, if you lay on it, then you're definitely going to have pain.
When you wake up with a lot of pain in the shoulder and you find yourself laying on it, that's why.
Yeah. You may hear cracking and popping sensations because think about what's happening. That shoulder, that bone's not being held in the socket as well because one of the muscles is being bothered or injured. So it's just sliding around, popping, cracking, not being held in place like it should.
Right, exactly.
So the tests, the first one, the common one, the one that everybody knows, it seems, is the drop arm test. Now, there's kind of two variations of this. One, let's say this is my painful shoulder arm. I bring it up like this with the non-painful arm, or sometimes you just have people try to lift it and they go like this.
Yep.
They can't lift it. But the other variation, they bring it up and you just let it go and see if they can hold it up. If they can't, that's a real positive sign that you have some damage there. Even if they can hold it up, sometimes we'll give a little push on it, and it just gives way right away.
Right. Yeah. It's a little painful. It can be. So.
Yeah. Next one, put both elbows at the side with a 90 right degree angle, and then have someone push both arms at the same time. So this is his painful shoulder. This is his normal shoulder. I'm going to push.
And I'm going to resist. I always
it's weak. You're supposed to give way.
Go ahead. Oh. Yeah. So, I always tell my patients, hold strong like a statue, and I'll push in. And this is very common. I would say vast majority, 90%, that injured side just goes in quite easily. It's uncomfortable, etc.
This one, we were talking about this. Not as common to find this one involved, but you just take your hand, palm facing out, and you can compare both sides. I'd be the same with this, Brad. I would do this to your good shoulder first, the non-involved shoulder, and see how that does. See how well you're able to lift it up. Then take the involved shoulder, and you may not even be able to get the hand up as high.
Right.
And then try to push it out. And you may not be able to push it out.
And if it's really, like you said, sometimes it's hard to even get
it in place.
There, or you hear you're doing this, and here it's like, and if you help it, it hurts more. You may get there, but it just doesn't go there. All of these tests we just mentioned, it's a good idea to do them on your good shoulder first, see how the mechanics are and pain-free, and then do
Then,
your
try it on the other
Yep.
shoulder. Again, we're not trying to make you doctors or physical therapists, but it'll give you an idea. Is it time for me to go see the doctor
right.
or my therapist, because these are all positive and kind of give you a start on trying to get that shoulder better.
And I do want to mention, if all the signs are positive and you go in, you get it confirmed by a doctor or therapist that you do have a torn rotator cuff, you do not always have to have surgery for
No,
that.
not by any means, not even close.
You can rehab that on your own if you do the proper protocol and exercises.
There can be a partial tear,
Mm-hmm.
but if there's a full tear where it's completely severed,
Right.
it's pulling away from the bone, they're probably going to have to do surgery.
Right.
But if there's a partial tear or a pin-sized tear,
and that's the thing. People aren't aware of that. It's like they hear the tear and they think, oh, it must be tore right apart. But it's not. Very often times there's a partial tear.
Yeah, we actually have a video, Brad. You don't know this, but a video of questions you should ask your surgeon.
Oh.
And one of the first questions is, could I try therapy first?
Right.
And in some cases, they're going to say no, because if you wait too long, they may not be able to repair it.
Yep.
And in most cases, they're going to say yes.
Actually, we did a video on a woman that she was like 55 years old. She was scheduled for surgery, never had therapy. Finally, she said, can I try therapy? Within 4 visits of therapy, the surgery was canceled. Her shoulder started getting better. And it was a wonderful situation.
Well, Jay, who invented the wall anchor, that's how I met him.
Another patient of ours.
He was a patient, and he helped us invent something. He had a torn rotator cuff. He's a rock climber, as you know.
Yeah.
And that was crazy. He was a full thickness rotator cuff.
Yeah.
He's back up. He's strong. He's
no surgery.
No surgery.
There you go.
We're miracle workers. Thanks for watching.
Pat ourselves on the back.